Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. Children who believe their gender is different from their biological sex should receive therapy for gender dysphoria. The U.S. Department of Health and Human Services said this on May 1st. Quote, psychotherapy is a non-invasive alternative to endocrine and surgical interventions for the treatment of pediatric gender dysphoria. Systematic reviews of evidence have found no evidence of adverse effects of psychotherapy in this context. End quote. The report goes on to state, quote, psychotherapy for adolescents with gender dysphoria is a well-suited intervention as it is intended to help patients develop self-understanding, engage with emotional vulnerability, and build practical strategies for managing distress, end quote. The report also said that procedures and drugs used in transgender treatments and surgeries, quote, carry risk of significant harms, end quote, including infertility, lower bone density, and heart disease. Quote, the evidence for benefit of pediatric medical transition is very uncertain, while the evidence for harm is less uncertain. When medical interventions pose unnecessary, disproportionate risks of harm, healthcare providers should refuse to offer them even when they are preferred, requested, or demanded by patients. Failure to do so increases the risk of iatrogenic harm and reduces medicine to consumerism, threatening the integrity of the profession and undermining trust in medical authority. End quote. Dr. Jay Bhattacharya, director of the NIH, said in a statement, quote, our duty is to protect our nation's children, not expose them to unproven and irreversible medical interventions. We must follow the gold standard of science, not activist agendas, end quote. The report noted that a number of U.S. medical organizations support children receiving cross-sex hormones and other gender-affirming care, and that the World Professional Association for Transgender Health Standards, followed by a number of U.S. facilities, recommend treatments as early as age 8 and procedures before a child becomes an adult. But some other countries, including the United Kingdom, have curtailed or banned such medicines and procedures over concerns about their long-term impact. 27 U.S. states have also enacted laws limiting the medicines that can be prescribed for youth who report having gender dysphoria. What are the other states waiting for? HHS said contributors to the report included medical doctors, medical ethicists, and a methodologist. Officials said the contributors were chosen because they are committed to scientific principles and because they represent a range of political viewpoints. Dr. Michael Antiguis, the president of the American College of Pediatricians, said that the report confirms that, quote, transgender interventions on minors, including puberty blockers, cross-sex hormones, and surgeries, cause irreversible harm, end quote. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.